Hey guys, it's Leah Buckles from Prestige Worldwide Medical Consulting. I am a U.S. Army veteran, physician assistant, and former CMP examiner. Today, I want to come on and discuss Pes Planus or flat feet as it relates to VA disability. So, a lot of veterans suffer from feet conditions or foot conditions related to service, to include plantar fasciitis, metatarsalgia, hallux valgus, posterior tibial tendonitis, which can affect the feet. And they are rated for them, right? So either by being, diagnosed directly or in service, or having it related to a secondary disability after service, or having an aggravation of a condition that was pre-existing service. So I want to touch on some of those things today to help shine a light on some common things that I see, right? So Pes Planus or flat feet, you can have a congenital flat foot or an acquired flat foot. So a lot of times if you have a congenital flat foot or you had flat feet at birth, that's going to be annotated on your entrance physical, either on your report of medical history or your report of medical examination, more likely. The report of medical history is the 2807, where you are going to discuss any ailments you've had in the past. And the 2808 is going to be the report of medical exam, where the doctor is going to, on the first page in the lower right-hand corner, there's a spot for a feet exam, and they're going to circle whether you have flat feet, regular feet, they're going to talk about your arch, right? So I see a ton of veterans that have gone into service with asymptomatic flat feet, and then either their feet got worse while they were in service, or perhaps their feet got worse after service, and then you would be looking at an aggravational foot condition, right? But if you developed a flat foot in service for a variety of reasons that we'll talk about, or you developed it after service, then it would be an acquired flat foot, right? It wasn't congenital or from birth, right? So how is it service connected? How are flat feet service connected, or a collapse of the arch? It can either be connected on a primary basis, as I mentioned, as it either happened in service, or on a secondary basis. I guess for the primary, if it happened in service or was worsened in service, or on a secondary basis caused by another condition or another service connected condition. Okay. So, let's see. Some of the things that I see that it's caused or aggravated by, would be, the biggest one is going to be weight gain, right? So if you have if you're a veteran that has gained weight due to another service-connected disability, what it can do is it can wear out your foot arch. You have something called your posterior tibial tendon that can get worn out, oftentimes due to weight, or if you've rolled your ankle a ton of times, and you can lose the support in the bottom of your foot. And you can develop an acquired flat foot, right? So if your little arch gets completely worn out and your foot just doesn't have support anymore, whether it's from chronic ankle rolling, from weight gain, from foot surgeries, from other issues, you can develop an acquired flat foot. So those are some of those secondary conditions that can cause it. Primary, again, aggravational, you have to show a baseline. So most often when I see these types of aggravational cases, you show that the baseline was normal, or there's some kind of aggravation of the baseline. So if your entrance physical says asymptomatic flat foot, right, and then you have been seen multiple times in service for foot pain related to flat feet, to me, that's an aggravation of the condition. Now, it can't just be a temporary aggravation. It has to be a sustained aggravation. So you continue to have foot pain after service, right? That's something I see quite often. I very frequently see veterans with pre-existing asymptomatic flat feet get turned down just because they were pre-existing. But that doesn't mean that that's where it ends, because if your service did truly, if you have in-service documentation where it was worsened, I think that that's evident that there's a good chance that your service did worsen it, right? Because you can show your baseline was normal and asymptomatic, and then it progressed, right? Even after service, if you had asymptomatic flat feet going in, but now 20 years later, you have symptomatic flat feet because you have gained a ton of weight due to your service-connected disabilities, or you've had other foot injuries on active duty. Now you have an aggravated foot because your baseline was normal, and then your service-connected disabilities worsened it. So I see a lot of those types of cases. And then as far as causation, if you have a normal foot exam going in, and then you get diagnosed with flat feet while on active duty or after active duty, if it's secondarily related to another condition, you can show that you had that acquired flat foot related to a service-connected disability or directly due to service. Okay. I hope that was helpful. I think the biggest thing for me is I see tons of these that are pre-existing. I do a ton of those types of cases for people. So I think those are some important things to note, is that you have to show a worsening of the baseline and that it's sustained, right? Not that you just had a temporary, worsening of it and then it went back to normal. Okay. Who can diagnose these conditions? Your family practitioner can, whether it's a family practice doctor, a PA, nurse practitioner, a podiatrist. You can be seen for this in orthopedics in a variety of locations. Oftentimes veterans will see physical therapy to help them if they're having foot pain. You can get inserts, usually diagnosed. It can be diagnosed just by looking at your feet, but a lot of times you'll get weighted x-rays that will show different angles and pitches of your feet that they will measure. You can get custom orthotics from the VA if you're entitled to VA care. A lot of people ask me about boot wear, tight boots, standing in formation, things like that, ruck marching. Well, I think that's kind of a tricky one sometimes. Those things can certainly add to it. There's some literature that I have that we discuss some of that. But a lot of people will say, everybody wears boots and stands in formation, and not everybody gets it. So it's all multifactorial, and we have to look at everything and all your risk factors with those types of things. So I hope this was helpful. Please place some comments if you have any questions or want to know any more information about foot disorders. I think we did a plantar fasciitis video a while back, so you might want to check that one out as well. And I'll talk to you guys soon. Thanks a lot.